Good afternoon. Today we'll be talking about patient lifts and proper patient transfer using an electrical patient lift. When you're going over the actual patient electric lift, when you're looking at the parts, you always want to make sure this is called the boom. You never want to push or pull on the boom when maneuvering the actual lift itself. This is called the cradle. You never want to push or pull on the cradle. This is the actuator or the lift actuator, which will help to lift or lower the patient. This is the grab handle. This is where all of your maneuvers, pushing, pulling, moving the actual lift around should be done when holding on to this grab handle here. Every electrical lift is powered by an electrical battery that is rechargeable, and you also have a remote pendant that will allow you to power and raise the lift up and down. Most electrical lifts will have a red button directly on the top of it or at the base at the front that will allow you to activate and deactivate power. When in storage, it is a good idea to have the actual lift deactivated as to not drain the power when in storage. The way you deactivate the power is simply press this button down and that will turn it off, making sure that there is no power going to the battery while in storage. Anytime you plan to use it for a patient lift and or transfer, you will slightly turn this knob to the right. It will activate. Moving upward, you will see your actual battery life powered, and then you can begin to use your remote control. You have an up arrow to be able to maneuver your lift boom upwards. And then you also have a down arrow to lower the patient after raised and being transferred onto a new surface, whether it's a seating surface, a commode surface, or another bed surface. When preparing for a patient lift, it is a good idea to use two people, one person to help guide and maneuver the lift, one person to help guide the patient. If you look at the actual base of your lift here, you do have wheel locks in the actual rear wheels. These rear wheel locks are only used when the lift is usually in storage. During an actual patient lift and transfer process, you never want to have the wheels locked so that if the patient's weight is not centered when raising, the wheels will be able to move themselves and readjust to center the patient's weight in order to keep the patient safe and keep the lift from tipping over, causing an injury or a safety situation. As well as on the base side, you do have a push pedal or lever that will allow you to widen the base. So if I turn this around, after pressing that lever, you have a wider base structure for your actual lift. This wider base structure allows the best stability and support when doing a lift and transfer of a patient. It is recommended to always have the base in this position when performing the actual process. However, if space is limited and you are unable to widen the actual base, you can still safely perform a patient transfer process with the base in this position. It's just that for best stability, it's always best to have the widest base possible. You do have a power cord here. The power cord is able to recharge the battery once it becomes discharged. You never have to worry about having a completely discharged battery during a patient lift and process because most electrical lifts will always have some type of emergency release that will allow you to lower the patient. So if you were using your remote control at any given time and the battery happened to have been discharged and is no longer has power, the patient would be in the air. You can take this here and turn that down, and that will slowly lower the patient. So you should never get stuck in a situation where the battery is completely discharged and the patient has to be lifted and raised in the air any longer than needed. You should always be able to put them onto another seating surface and or laying surface and then take your lift over to the electrical outlet, plug it in, and allow it to charge once you finish your patient lift and transfer process. If this is plugged in, your remote panel and the actual lift will not function properly because it's sensing that it's in a charge mode, and anytime you have a power cord plugged into a wall outlet, it prevents a tripping hazard, especially when trying to move this around and prepare a patient lift for a patient lift and transfer process. I'm going to show another type of lift. It's also an electric lift as well. However, it has an electrical powered base. So if you give me one moment, we're going to switch lifts. This is also another style of electrical lift with a powered electric base versus a manual push pedal base. So the only other option that this base has, or this lift has, that the first lift does not have, would be that on your remote control, you have an extra set of buttons that will allow you to widen the base and narrow the base accordingly to your setting, okay? So same thing here. This is your battery. This is your power button. When in storage, it's pushed in to conserve battery life. Slightly turn that to the right, it pops out, it activates power to the actual lift. Then you can actually use your remote control pendant to go up or down. And then if you were going to have enough space and space permitted, if we wanted to widen the base, that's where these extra set of buttons would come into play. So you can widen the base to its widest position for best of support and stability, or narrow the base if the widened position is not allowed. Between the two lifts, that is the only difference. This is still the grab handle. This is still called your boom. This is still the cradle, your base, and your lift actuator. At the top of this one as well, you do have your emergency, just as the one previously, where if you're performing a lift and transfer process for a patient and the battery were to be completely discharged, you can take this and turn this clockwise, and it will slowly lower the patient down onto another surface, whether it's a seating surface, commode surface, and or bed surface, okay? So that is how you actually maneuver the actual lift itself, the parts of the lift itself, and how you actually use the remote control. This also does have a power cord to be able to recharge the battery once it's actually plugged in. If at any time the battery needed to be replaced for some reason, you had a spare battery, there is a clip right at the top that you squeeze that and you lift up and pull forward. When you place it back, you want to make sure that these contacts connect with these contacts here on the charge box, and that it locks into place. And you just simply shake a little bit so that you know that it's firmly locked in place and it's seated directly on the actual control box itself. So when in storage, power off to conserve battery power. Next, we're actually going to perform and move over to a lift and transfer process after describing a few of the sling options that are available to perform a lift and transfer for a patient. Okay. This is an example of a mesh style sling without commode opening with 4-strap color-coded system. You have blue, green, purple, and black for shoulder straps, as well as blue, green, purple, and black for the leg straps. This here has a weight capacity of 600 pounds. You actually have a grab handle here to help reposition the patient when actually lifted in the air, to be able to make sure they're going to be seated well in the chair and or commode or bed itself. Okay, the tag area here is going to always go up behind the patient's head, always away from the patient's skin. Okay, so grab handles to the outside, away from the patient's skin, label away from the patient's skin, up towards the head area. This larger strap here goes towards the bottom of the thighs, just underneath the knee area. Okay, we have another style of sling as well. We're going to move on to the next one. Okay, this is another style option as well. This is a mesh sling with commode opening. As you can see, you do have a commode cutout for those patients that do have any type of wounds or sores in the coccyx area that would need to be treated and or cleaned, as well as if the patient needed to be transferred from a bed, chair to a commode surface or a toilet surface so they can use the toilet and be able to relieve themselves when necessary. Same thing here, you have color-coded strapping system, blue, green, purple, and black for your head shoulder straps, blue, green, purple, and black for your leg straps. Same features, the label always up towards behind the patient's head. You have straps here to hold as grab handles because one person can help guide the patient and the other person will help maneuver the actual lift. This should be at the bottom of the buttocks or the coccyx area where the patient will be able to expose themselves and have relief when sitting on a commode. And then this will same thing go underneath the bottom of the thighs, just behind the back of the knees. Okay? We'll move on to one more. This here is another style option of what they call a U padded style sling or divided leg sling. This is easier to apply for patients that are going from a bed to a seating surface or a seating surface to a bed surface. This is the back support. This here has a head support as well. You always want to position this at the base of the tail of the spine, and then this would come up the back and to support the patient's head. You do have straps here for your shoulder straps, and then you have 3 different placement settings for your leg straps. These here are the actual leg straps. So if this were to sit behind me at the base of the spine, just like that, these leg straps will go from the outside of the thigh around towards the inside of the thigh on both sides. Okay? And once you do that, these will then connect to your actual cradle of your actual sling. And that's how this is called a divided leg sling, because it will keep your legs divided. One will go around one side, one will go around the other side, and will keep the legs divided and always keep the patient in a seated position when seated, okay, and raised. So that is called a divided leg sling. Now the next thing we're gonna do is do a couple actual mock transfers so we can kind of give you an idea of how to apply the sling and get the patient ready for a patient lift and transfer. When preparing a patient for a lift and transfer process, you would always want to make sure, if you have the bed frame and you're going from the bed to a commode and or wheelchair, that the both items are in close proximity to one another. This is called a patient lift and transfer. So we do not want to travel over longer distances than needed. When you actually have your sling choice option ready, first thing you would want to do is fold the sling and prepare for what they call a roll and tuck procedure. Rolling and tucking this underneath the patient when they're actually in the mattress itself. So we take the sling, fold it in half so that the label is to the outside. Take that half and fold it in half again. Now we would be with 2 people to be able to help position and reposition the patient. One person would stand on one side of the bed, another person would stand on the other side of the bed. We would speak with the patient and let them know that we are going to roll them one way so that it would allow us to take this half plus half of the other half and unfold it. So once the patient is rolled one way, we would take this, unfold it, and kind of tuck it underneath them. That's why it's called a roll and tuck. So we roll the patient one way and tuck this underneath them. Now we switch sides, and then one person will still stand here, one person will stand there. We will now roll the patient the opposite direction. And when after rolling the opposite direction, it will allow us to take the other end of the sling and pull that outwards to the side so that now the sling would be underneath the patient completely. Patient's head should be within the sling area here, shoulders here, going downwards. This should be in your tailbone or coccyx area here. Legs should pass through this strapping side here. So that we can prepare the patient and not have to lift the lift as high if your bed is electrical and or manual, and it does have elevation or can raise in height, you can use your bed to advantage to prepare the patient. So if you raise the bed first, that would allow the patient to come up to a higher height starting position, so that after we maneuver your lift to the bed frame and over the patient, we can now then lower the bed before beginning to lift this, so we don't have to lift the patient as high. So my bed is in its highest position. You always want to make sure power cords, any type of weight, anything that's underneath the bed frame that may cause obstruction of the wheels or the base of the lift need to be cleared and out of the way. Okay? We would take our grab handle, hold it here to be able to maneuver our lift into position. If this is not high enough to clear over the patient without coming in contact with the patient, then you want to make sure first your power is activated. Take your hand pendant, widen your base for a better lifting support system, or stand on the leg lever if it's a manual operation. And then we can elevate this to a point where it's a little bit higher than the patient's body. Then we can take this and roll this over the patient's, okay? And then you would turn the cradle so that it's left and right of the patient's body, never where this is towards the head or foot, okay? Always left to right. This here is called a 6-point cradle because we have 1, 2, 3, 4, 5, 6 different points where we can actually attach our slings. Whenever using a sling that has 4 corner strapping systems, we will be using the 2 corner points on both sides of the cradle system. Now the reason your sling straps are color coded is so that you can easily distinguish and make sure that when connecting to your cradle, the color-coded straps towards the shoulder are the same, and the color-coded straps that you use towards the legs are the same on both sides. Whenever doing a lift and transfer and connecting the straps to the actual cradle itself, the rule of thumb is to use the shortest loop possible towards the shoulders, and then you always want to go a little bit longer towards the legs so that when the patient is actually lifted, there'll be more of a seated position. So once you maneuver this over the patient, if it's a little too high, we can now lower it down, always being mindful of how low you put this as not to cause any type of injury to the patient by coming in contact with their body. Then you would take either your blue, green, purple, or black, depending on what's most comfortable according to the patient's body type, and hang this on one side of the cradle. And the same thing, same color that you use on one side, you would use the same color on the opposite side. So if I use green on one side, I'm going to use green on the opposite side. Okay? So now that I have green strap connected for my shoulder straps, we said we always want to go longer towards the legs. So I would have to use either purple or black to go a little bit longer. The reason you go a little bit longer towards the leg is so when the patient is actually lifted and raised, they'll be more facing forward in a seated position than leaning backward, kind of looking upward. Okay? It's great to be able to have the patient facing forward so you can have eye contact and be able to communicate with them during the whole process and procedure. So once you have your color-coded straps that's chosen and connected to your 4 corner cradle points, before beginning to actually lift any higher using your remote pendant, because we raised our bed at first, we can actually start to lower the bed to start to set the patient and set them in the actual sling. So if you look here, the sling straps are starting to get tension in them. The patient would have weight in there. So after you lower to the lowest position, if you can see, the patient is already already started to be lifted and raised from the surface. Then you take your remote pendant and finish the rest of the process by lifting just a little bit higher. Okay? You only need to lift high enough where you can fit one hand underneath the patient. Okay? You don't want to lift it too high to cause a safety situation, and you don't want it where the patient is dragging across the surface of the actual mattress system. So once you have one hand clear, that's more than enough space. Wheel should always be unlocked during the whole process. We would go ahead and take this grab handle and back away from the actual bed frame. Okay? If the patient is going to be suspended in the air like this for a few minutes or any amount of time, it is okay to have the patient's head here. It is okay to have the patient's head on this side as well. When in actual lifted, they should be placing the patient's head here, always facing forward towards the person that is maneuvering the lift. Never should their head be placed underneath here, because as you're raising and lowering, your boom and actuator can come in contact with the patient as they're lowering down onto the other surface. So only left, right, or in front of the actual boom itself, never underneath the boom. Okay? So that the patient doesn't have to be raised so high, you can lower them down so a better support system. We have here our wheelchair ready for our patient transfer. We want to make sure they're close by each other. If any wheelchair has wheel locks, always make sure the wheel locks are engaged. If your elevating leg rests are going to be in the way, it's okay to release them from the actual chair and place them on the side until the patient is actually transferred into the actual chair. So wheel lock is locked here, wheel lock is locked there. One person will be holding here the grab handle. One person will be holding back here to be able to guide the patient. Okay? We will take our grab handle. Since our wheelchair is close to our bed frame, we don't have to go far. And then we go forward and place them in. One person will be standing behind the wheelchair to make sure that they are holding the patient in a good position. And then the other person will be maneuvering the lift to be able to lower the patient down and seat it. Once they actually become seated, you still want to be mindful of how low you lower this down so that it does not come in contact with their head and or body. But you do want to lower it to a point where your straps are free enough to be able to loosen and disconnect from the actual cradle. Okay. It is okay to leave the patient in a sling if they're going to be here for a short period of time, and then you plan to transfer them back onto another surface later. Okay. Once you disconnect the straps, then you can go ahead and back away from your actual wheelchair, and then of course you can go ahead and put your leg rest on back on and get them ready for the patient to use and be transported in the actual wheelchair. If they actually wanted to remove this from the patient while they're in the chair, what they would have to do would be having two people, one person in the back, one person in the front. They would have to lift the patient's leg up a little bit and then kind of fold that and slide it back underneath them, and then let the legs back down. Then they would ask the patient to lean forward, so when they lean forward, they can start to pull that out from the back. Okay? We will show you another sling for the divided leg sling option. So this here is an example of how to use the divided leg sling or U-padded style sling with head support. A good idea first is take your leg area and fold it upright on both sides so that you fold them backwards. Then, if the patient was in a chair, this is actually an ideal sling to be able to use from a chair going to a bed, because it's a lot easier to be able to get this underneath the patient than your Commode sling or full body sling with Commode opening or without Commode opening. Same thing would happen. Two people will help guide the patient. One person stands in the back, one person stands in front to help support the patient as we are asking the patient to reposition in the chair. So while standing in the front of the chair, we would ask the patient to lean forward. We have it folded like that so that we can take this and slide it in the back behind the patient in their chair. Okay? Once we slide that in the back of the chair, we can take this here, unfold it, and put it down on the side of them. Same thing here, unfold it and put it down on the side. Now, that will be behind the patient. We would ask the patient to lean back in the chair again so that they're actually seated and rested against the back of the sling. This is seated at the base of their spine. We would ask them to lift one leg up at a time and go from the outside of the thigh towards the inside of the thigh and wrap it around the leg. And we would do the same thing on the opposite side, going from the outside of the thigh to the inside of the thigh and then in between the legs. Okay? So once the patient's actually in the sling and it's there, then you can go ahead and have your lift prepared and ready for your actual lift and transfer. If your leg rests are in the way, simply remove them, place them on the side as previously. Hold on to my grab handle. I make sure my base is in the widest position if possible. Make sure that my cradle is in a good position so that as I approach the patient, it's not coming in contact with any part of the patient's body, head, shoulders, or upper torso. And I move this into position. Okay? Same thing, always making sure if the wheelchair has wheel locks or any chair has wheel locks, the wheel locks are always engaged. Then we can go ahead and lower the cradle using our remote pendant, being mindful of where the patient is in regards to the actual cradle system. Okay? This strap here can go right around this corner strap there. This strap here goes right around the corner shoulder strap there. Okay. This goes from the outside of the thigh toward the inside, just like that. And this one also goes from the outside of the thigh towards the inside of the thigh, just like that. Now, before actually connecting these to your cradle system, you want to take this and slide them across from each other. And then we would use either the short, long, or longest to connect to your actual cradle system. Okay. So I use the second one there, use the second one here, and that's the kind of a example of how it should be looking when connected to the cradle. One of the patient's legs would be through that loop, one of the patient's legs would be going through there. Now we would use our remote pendant to go ahead and actually lift the patient up from the seating surface. Once they are free and clear, with one hand width underneath the seating surface, one person is still standing on the opposite end, one person is maneuvering the actual lift. As we back away from the chair, the patient will be guided by using the grab handles in the back, okay? And the patient would be seated in here just like that, always facing forward. And if you're gonna go from a chair to a bed, same thing. Raise it high enough so that we can go back towards the bed surface So after confirming your clearance, then you would go ahead and reposition the patient by turning the cradle so that the head is laying towards the head position and the legs would be resting towards the leg position. One person can still go ahead and use this strap here to kind of hold the patient in place, in position still. And as you're lowering them down onto your mattress surface, you would lower to the point where the patient's head would be here and the patient's leg would be there. And then same thing, just be mindful of how close you are lowering this down to the patient as to not come in contact with their body, causing any type of injury or safety situation from coming in contact with the cradle. Once your straps are loose, disconnect them from the actual cradle system itself. Head section as well. Then of course, hold your grab handle, back away from the patient, and then proceed to go ahead and place your lift for storage purposes. I would lower this down, narrow my base, and then ensure that the power is turned off. Now you're ready to take this and move it to your storage area and then plug that up and charge it for our next patient lift and transfer.